Charlie Branson. I'm the biologics manager at Nebraska Medicine and the University of Nebraska Medical Center. And I'm here to talk to you this morning about what to expect during your FACT accreditation inspection for your processing facility. We have a few objectives on the agenda this morning. One is to understand the expectations that will be placed upon you as someone seeking accreditation. Also to provide tips to help successfully navigate the inspection process and to kind of summarize the experience of the inspection day. So our first objective, understanding expectations. So one thing to point out is that as a program that's being inspected and as an inspector that will be performing the assessment, both parties have similar goals. The goal is to do a comprehensive assessment, whether it's you assessing your own program or the inspector assessing that you as the program, providing evidence of compliance. So the program will have to show evidence of compliance for all the standards through tours, conversation, documentation, and the inspector will be looking to see that evidence of compliance as they go through the checklist process for the accreditation. Lots of documentation to compile and review on both sides. And ultimately, the goal is for all programs that go through this process to meet the standards and the requirements of the FACT accreditation manual and ultimately receive program accreditation. One of the biggest things that you can do as a program is to conduct your own mock inspection with your team members as you're preparing for this inspection. Obviously, this will help determine gaps in procedures, documentation, and practice well in advance of your accreditation visit from FACT. It'll also help you understand the roles that your team members play and will play on inspection day. So whether those are lead or support roles, identifying subject matter experts, staff that could be involved as it relates to processing or interviews, and understanding who your primary points of contact will be for the inspection team. This also gives you an opportunity to get very comfortable with your program. Just one is your general approach and organization as a program. Also help you understand what kind of space you will need to conduct the assessment and readily identify that space. Also the assets and materials, whether that's IT, audiovisual, etc. And will help you get a better feeling for how the inspection flow can go, how to navigate your facility to show the inspector everything they need to see without being overly invasive. Expectations from the inspection standpoint, obviously is a dedicated space to perform the inspection and to have that one-on-one time with the inspector to go through the checklist and be conversational. I would recommend that each element of the program being inspected have its own separate space. I have been on inspections where I was performing an inspection in a very small room right next to the apheresis inspector. And so at times that made it a little difficult to interact as you were hearing a lot of different conversations going on in the room at the same time. Make sure you have all the computer resources you need. Make sure that you engage your IT staff early in terms of resources, access, availability for printing, dedicated monitor or projector setups. A lot of days, a lot of programs today have electronic platforms that can be viewed online. And so there will be navigation requirements as well as viewing requirements with those. And it's also good to think about backup plans. Usually there's always something unexpected that happens on the day of inspection. Hopefully it's not as large an ordeal as unexpected absence, but these things can occur. And so it's good to understand what your role in the fact inspection is going to be, who your designee is, making sure that they're prepared just as well as you are, so that regardless of who's there or not there on the day of the inspection, that you have key personnel identified and that everybody can step in and participate in the inspection for the various roles that are needed. Jumping down to objective 2 here, talk a little bit about some tips to help successfully navigate the inspection process. I think this is your, as the slide said, this is your best friend. This is the bread and butter, the accreditation manual. You want to start reviewing this early and literally going standard by standard, assessing where you are in compliance with that standard. The nice thing about these manuals is they do give a lot of detailed explanations as to how an inspector may look for evidence of compliance or the things that they are specifically looking to assess. It will help you understand what compliance to a specific standard looks like, so that you can be sure that on inspection day you meet that level of compliance. In some standards it's highly prescriptive and others it's not. So it's a really good way to really understand what fact and the inspectors are looking for at every step of the level of the process. Also, as you prepare for your fact inspection, again, considering who should be present, who is doing the prep. I've seen this done a lot of different ways, whether it's the operations team or the quality team at the processing facility. Both areas have a role to play, and I think the inspections go really well when operations and quality are synced together and have a lot of functional synergy in preparing for these inspections. Thinking about who's going to be spending their day with the inspector. Again, fact inspections generally run the entirety of one day, and there's some required interaction with the facility directors, medical director, your quality manager, and operational personnel. So thinking about who those subject matter experts are, who are the people that can best speak to how your program functions on a daily basis. Also in preparation is document collection. As you start going through the standards, you want to make sure that each standard is accounted for. Sometimes I've seen where folks have made a evidence of compliance crosswalk with the compliance application checklist, where they're referencing SOPs, documents, records for every single standard. These types of things come in handy when on inspection day you get asked about a specific standard or a specific piece of evidence of compliance, and then you can readily reference that and pull that out. A lot of people use the binder method to organize things, and they systematically go through the standards and organize these binders with their evidence of compliance, whether that's printouts of procedures, copies of records, etc., for the inspector to systematically walk down and get explanation from the staff as needed. I think one of the things in showing compliance with the standard is to be specific. That's where the accreditation manual comes in handy to really help you understand what is the specific element of the standard that is being assessed. Be able to reference actual procedures, validations, labels, and worksheets. Sometimes the inspection can be conversational, and you can just talk hypotheticals, but in a lot of ways it's good to be able to show, here's the situation that came up, here's the specific deviation we dealt with, etc., and be able to explain exactly your process through that. As part of your document collection, there's also the element of electronic documentation that comes into play. Electronic documentation is very beneficial as a program to keep you organized. But sometimes during inspections, it's easier to have printed documents readily available. Again, this kind of is determined by the inspector. Sometimes trying to search databases online can be very time consuming. So having things organized in a designated folder on a server so that you can quickly reference those helps. Also remember, this is a reliance on technology, and sometimes we experience those unexpected downtimes. And so you're going to have a way to function through the inspection process, even if you run into one of these technical difficulties. So another element is about just preparing and practicing. So we kind of alluded to technology failures. Excuse me. Kind of alluded to technology failures and making a plan with IT and media support personnel, making sure that you have additional equipment and make sure you have access to data and on-call IT personnel to help troubleshoot anything. Testing the equipment, in proximity to the inspection day is a good practice to make sure that things are working properly, that your software is opening and you have access to the different things that you need. From the processing standpoint, you need to prepare staff for the possibility that the inspector could ask them specific questions. They may have to demonstrate specific tasks like how would you label a product or how would you process a product? How do you handle alarms in the facility when you're in your processing area working? So it's good to advise the staff to make sure that they're refreshed on their knowledge and contents of SOPs. If they're asked a question, it's okay to say they don't know the answer. The biggest thing is that they understand where to get that answer, and that should be from their SOPs. That should be readily accessible wherever they're at. And in going through this process before the inspection, this will also help determine if there's knowledge gaps with the staff in processes or that need to be addressed, whether that's in procedure or just a routine practice. Also need to think about whether there will be collections or anticipating collection procedures or processing procedures on the day of the inspection. If there are no procedures underway, then a mock procedure can be demonstrated at the request of the inspector, but it's good to prepare for that. At times some of the conversation can walk you through the process and you can get a good understanding of how that goes. At other times, it's nice to see staff at work and understand how those processes are truly being carried out. The other thing, and this is more of a programmatic perspective, is educating your staff on how your processing facility integrates with the collection and clinical programs you support. So it's not just about the knowledge of how your processing facility works, but how you work collectively to integrate with the collection and clinical programs. One thing to remember is to be a gracious host. Remind folks to be friendly and interactive on the day of inspection, but also be supportive and confident in the system and the supporting evidence that you've brought forward for your inspection. Snacks and beverages being available are always a plus. There is a requirement to plan lunch for the inspectors, but I would tell you it's also a nice gesture if you can to do it for all the staff that have been involved in the preparation for the inspection process. for all their hard work and efforts. And one thing to remember too is that you're inviting this voluntary inspector in to evaluate your program and help you improve. And I make this comment because at times during the inspection process, you may feel that you're doing what you need to do. The inspector may not be seeing it the same way you are. And remember, this is a collegial exchange of information here. The inspector doesn't have the final say on whether it will be a formal citation of non-compliance. They're observing, they're making recommendations back to the accreditation committee, but it's always nice to interact with a program who can kind of take that constructive criticism and keep it positive. Lastly, kind of summarizing the experience of the inspection day. Some things going into the inspection day. Remember, the inspector wants you to succeed. This is your chance to shine both programmatically and individually. And if you put in the work, all that preparation and hard work will show and ultimately should be rewarded. So this is an example of a way to kind of organize yourself in preparation for the fact inspection. Certainly isn't a need, but this is just kind of a systematic breakdown of where everything is and who has it and who's responsible for it. So some sort of preparation to ensure that that every team member knows how to quickly reference where the information is that they need, who's controlling that, who's presenting that, etc. A list of contacts for the day of inspection. So all of your processing program staff, any hospital administration, equipment, bioengineering, biomed folks, environmental services staff. So all of these kind of ancillary support services and folks that are involved with the facility operations at your organization, it's good to have all these folks on speed dial the day of the inspection. On the inspection day, at a minimum, having immediately available all of your relevant facility SOPs, completed worksheets, forms, and labels. So this would be your processing records and labeling, training files and competency files on staff, qualification and validation studies of critical equipment and processes, documentation of investigation of errors, accidents, any kind of biological product deviations or serious adverse events, outcomes analysis, any of your audits that you've been performing and as part of your annual audit schedule and during the interim of the accreditation cycle, and the annual review of your quality management program. Probably about half of these things will likely be asked for in your compliance application submittal, but it's always good to have these things readily referenced and handy so that if the inspector has any additional questions about any of these things, you can readily work with them to resolve those. Kind of your inspection day lineup, considering who needs to be in the room, making sure that only the necessary people are there, your subject matter experts, quality folks that might be taking notes, any kind of transportation or kind of a go-between areas for collecting different things and bringing them back and forth to the inspection space. One of the things you're going to want to do is orient the inspector to your facility. So it's good to provide an overview of your operations, facilities, and participants in the inspection. Generally, there's a large programmatic introduction, but I certainly would recommend a focused secondary inspection to orient folks to your facility. I would explain how your documentation and supportive electronic systems work up front at the start of the day. So it gives the inspector an idea of how the general quality management system and operational systems function. And I think the big thing is to be prepared, but be flexible and agile. Inspectors come from a variety of backgrounds and have a variety of ways of doing things. Some inspectors will want to drive inspections very much to their own internal checklist of elements. Other times they may prefer to kind of ride along in the process and let you drive the boat a little bit and see where things take you. Fact values your feedback. So once the inspection process is over, you will have an opportunity to provide feedback on the inspector, the inspection team, the inspection process, in ways that FACT can improve the interaction with programs seeking accreditation. And so this is kind of that two-way communication, that collegial process here, that this is voluntary. Everybody that's inspecting you comes from accredited programs. So they can help you identify ways to improve their program, or they may even identify ways to improve their own program based on how you do things. But this is definitely an integral part of the accreditation and inspection process to provide that feedback. Kind of key takeaways from the presentation. From a preparation standpoint, there is a large time commitment, an extreme attention to detail. The more that you can be attentive to detail in the prep process, the easier the inspection should go. High level of organization, making sure that in your preparation that you're highly organized, and that will also make things go very well on inspection day. And having contingency plans for absences, technical difficulties, etc. From the inspection standpoint, I think the key takeaways is everyone is nervous, but enjoy the experience. You're seeking this accreditation because as a program, you want to do things at the highest level. And this is all about bettering your facility and bettering your program. So it is a collegial process to systematically improve quality, and dialogue for the experienced and the inexperienced to exchange ideas. So this is your inspector with the program as a newly accredited program, looking for ideas and ways to exchange information on best practices, all to achieve our collective common goal of patient quality and patient safety. And so with that, I will leave you with this. From my perspective, I think a well-organized and well-prepared program will easily highlight the synergy between operations and quality for the inspector, and that your journey to accreditation should draw your team and your programs together with the singular focus of patient safety. So thank you for your time and attention this morning, and now we'll be ready for some questions.
The Biologics Production Facility is located on the main campus of Nebraska Medicine in Omaha, Nebraska. The 12,000 square foot cleanroom facility operates as a critical venue for researchers to transition small-scale basic science research findings to useful therapeutics at the bedside through Phase 1 and 2 clinical trials. The Biologics Production Facility supports our clinical blood and marrow transplant and immune effector cell programs, as well as providing manufacturing support for novel cell and gene-based therapies. The facility is designed and operated to comply with GTP and GMP regulatory requirements. The Biologics Production Facility is a secure site with each entry point requiring authorized badge access to enter. The main entrance remains unlocked during normal business hours, Monday through Friday, 8 a.m. to 5 p.m., to allow visitors and unauthorized personnel to enter the main lobby. Once inside the main lobby, visitors are required to sign in to the visitor log and must be escorted by an employee at all times. Access to office areas, locker rooms, and processing areas are restricted to authorized badge access only. Visitors requiring unaccompanied access to the facility must undergo lab safety and basic GMP training before being issued a visitor badge. The visitor training is good for 1 year and must be refreshed annually. All of these requirements are designed to help us comply with D2.1.3 of the FACT standards. All supplies and reagents entering the biologics production facility are controlled by our Materials Management Program per Section D6 of the FACT standards. The receiving room is kept clean and sanitary, and materials are stored in a way that prohibits contamination. When materials enter the facility, they are placed in quarantine, which is designated by the orange shelves, as well as an orange quarantine sticker on the material packaging. Materials then undergo a visual examination for evidence of damage or contamination. They are entered into our inventory control system, which captures the material name, quantity, manufacturer, lot number, date of receipt, acceptability, and expiration date. Supplies and reagents are purchased from approved vendors and require an acceptable certificate of analysis upon receipt. All materials also undergo an initial qualification and approval before being used in manufacturing. The storage shelves are up off the floor and organized in a way that doesn't block the fire sprinkler system. Once materials are approved for use, they enter into the classified space via a designated pass-through. Non-electronic items are wiped down with sporicidin disinfectant wipes, and electronic devices are wiped down with 70% IPA prior to being placed in the pass-through. These disinfecting measures help reduce bioburden in the processing area. Materials are stored inside the classified space in designated supply rooms in accordance with the manufacturer's storage recommendations. The supply rooms are kept orderly to make materials easier to find and to prevent mix-ups. Temperature and humidity levels are continuously monitored in the supply storage rooms. Supplies and reagents requiring cold storage are kept in temperature-controlled walk-in coolers under the appropriate environmental conditions, which are also continuously monitored. Entrance into the cleanroom areas is restricted to trained personnel having defined tasks in the area and to escorted visitors. Employees enter the classified clean space through designated locker rooms. The locker rooms are considered unclassified space but serve as a transition space from unclean to clean. The locker rooms are cleaned regularly and monitored as part of our environmental monitoring program per Section D2 of the FACT standards. The locker rooms are equipped with lockers for storage of personal items as well as access to sinks to promote proper hand washing and disinfection. Food, drink, candy, and tobacco products are prohibited in the processing facility. Storage shelves within the locker rooms contain all of the necessary PPE required to enter the classified clean space, including hair nets, beard nets, shoe covers, face masks, coveralls, and gloves. PPE is for clean room use only and is not to be worn outside of the clean room per D2.9 of the FACT standards. Procedures for proper gowning and personal hygiene are documented in our Gowning and Working in the Biologics Production Facility procedure, as well as posted on the wall in each locker room for reference. The Biologics Production Facility has Class 100,000 and Class 10,000 clean rooms. The production environment is controlled by our building management system that provides continuous monitoring, control, trending, data archiving, and alarm capabilities for 5 HVAC air handling units, various exhaust fans, USP water purification, hot and chilled water supply, vacuum system, process utilities, and other related systems. The building management system is maintained, verified, and calibrated in accordance with applicable regulations and standards. The cleanroom environments comply with Section D2.1 of the FACT standards, as well as 21 CFR Part 211 GMP regulations and are constructed with smooth, hard surfaces that are easily cleanable. The layout of the rooms allow for proper cleaning, maintenance, and operations. There is adequate space for the equipment in the room and plenty of lighting for employees to perform their duties safely and effectively. There are separate and clearly defined areas for different operations to prevent contamination and mix-ups. Non-biohazardous waste is removed from our facility on a daily basis by our contracted cleaning service. Biohazardous waste and sharps are removed from our facility by separate specialized medical waste contractors on a regular basis. Safety manuals are located throughout the facility and are readily accessible to staff in accordance with Section D 2.7 of the FACT standards. The safety manuals include information on behavioral emergencies, blood and body fluid exposure, bomb threat, cardiac arrest, disaster response, earthquake and explosion, fire emergency, SDS retrieval, hazardous materials spill including chemical and radiological hazards, and severe weather plan. The safety manuals also include emergency contact information for key departments. There is a designated room for QC functions that is separate from processing and storage areas. The QC room is designed and constructed to the same standards as the rest of the facility with adequate lighting, air filtration, and smooth, impervious, cleanable surfaces. The facility has a media prep room that is separate from the main processing areas. This room serves primarily as a backup to the main Class 100,000 processing rooms and houses redundant critical equipment that can be utilized if the main processing equipment fails or is needed due to an increased demand. The biologics production facility maintains 7 separate Class 10,000 processing suites. The separation of the processing suites helps minimize risk of improper labeling, contamination, cross-contamination, and mix-ups. The separate suites also allow us to accommodate research activities that can be completely separated from processing of human cellular therapy products. The processing facility maintains a separate room for the cryopreservation and storage of cellular therapy products. The product storage room is accessible via key card access only and is off limits to unauthorized personnel and visitors. Each freezer unit is continuously monitored to ensure appropriate storage conditions are maintained per Section D 9.5 of the FACT standards. Visual and audible alarms are in place if storage condition failures occur. Temperature, humidity, air control, and surface contamination are also monitored in the product storage areas. An electronic inventory control system is used to help maintain product segregation, i.e. quarantine versus release status, as well as product identification and location within the freezer units. Compressed CO2 gas and liquid nitrogen are stored in secured locations where access is restricted. All areas in the facility where liquid nitrogen is used are continuously monitored by oxygen sensors per D2.1.2 of the FACT standards. The processing facility is cleaned on a regular basis in accordance with D2.4 of the FACT standards and our internal cleaning SOPs and cleaning schedules. Cleaning and sanitation procedures were developed based on room classification and the type of processing taking place. The cleaning procedures are validated for their intended purpose, and cleaning effectiveness is monitored on an ongoing basis through our environmental monitoring program. Records of cleaning activities, as well as environmental monitoring results, are maintained. EM results are trended and analyzed to ensure the facility is maintained in an appropriate state of cleanliness. Records are stored and maintained in accordance with Section D.1.3 of the FACT standards. Physical record storage of SOPs, validations, occurrence reports, change requests, and processing records are kept in a secure location that is only accessible by keycard. Records are also scanned and stored electronically on a backed-up server. We utilize an electronic document control system that manages document creation and revision, change requests and approval, staff training on documents, and periodic review. The electronic document control system is backed up daily on an external server. A downtime binder that contains current copies of all SOPs, forms, and worksheets is available in both physical and electronic format in the event of a system failure.
Hi, Charlie.
Hello.
It was a great presentation and a pretty amazing lab. I think we all agree with that. You're a very lucky person to be in such a sweet facility. I did want to make a comment that I really loved the video with respect to the regularly referenced fact standards as you're moving throughout the virtual tour. That is like extremely wise and very helpful for virtual inspections anyway, as a fact coming from a fact inspector perspective.
Yeah, we did that primarily just to, that in planning for a virtual inspection, there's a reference document out there about how to conduct a tour, and it kind of just lays out kind of just a summary of different things to try and present in this virtual tour scenario in prepping for those. So we just made it a point to try and reference those as we went through that process.
Yes, great idea. I have a few questions for you. So your first question is, hi Charles, have you and your team undergone a virtual inspection for lab processing yet? If so, could you share your experience with us? If not, what should we expect?
So we have not undergone a virtual inspection here at our facility. We are due for fact accreditation sometime this summer. But I can say that I have done a virtual inspection as a processing facility inspector. From that point of view, I think obviously there's a lot of time and preparation that goes into a fact inspection. I think being able to be a little more organized in preparation for the virtual inspection is a good thing, just so that there's not any significant downtimes while you're interfacing online. It seems like the delays online when you're interfacing as opposed to being in a conference room, they seem like they last 10 times longer and potentially get really awkward. But I think spending a lot of time on the video is helpful. Also spending time just in an intro, kind of an introductory type slideshow to present the facility and just kind of your background information about how you function really helps the inspector kind of orient themselves to the program, to the space, and then you can dive right into those tours and really start pointing out the things that they need to focus on from the fact standard compliance standpoint.
Thank you for that. Another question we have for you is, how many hours, an estimate, you probably know where I'm leading here, for your program to prepare the inspection? How many personnel are involved in the preparation?
I think that's pretty variable, and a lot of it has to do with the size of the program and kind of the scope of what you perform. Obviously, the fact standards, there's so many standards, and you have to go through all of them. When you get into the processing aspect of it, at times that can go quickly, or it can be it can definitely take quite a bit of time if you're doing a lot of unique processes. If you're doing CAR T manufacturing, if you're doing immune effector cell handling and management on top of supporting blood and marrow transplant. A lot of it depends if you're just an adult autologous program or if you're an auto-allo program and you have peds. So the scope of practice always kind of influences that amount of time and preparation. It's hard to say. I think from the best references that we just went through initial fact accreditation on the apheresis side. So for years we've had an external vendor
that worked here at the facility with us, and I was a part of that, and have a management role over on the apheresis side. And it was from the time we decided that we were going to do apheresis and wanted to internalize that. We were, from that decision point, it was about 18 months until we got officially fact accredited. So we were building the program, hiring staff, writing procedures, and then obviously once the caveat with accreditation is that you need to be functional with all of your processes and your procedures in place for a year before you can officially be accredited. So you kind of get everything geared up. I would say about 6 months into our operation, we had a colleague that was an apheresis inspector for fact come in and do an inspection for us, to help us out, to understand our preparation level and everything else, and to see where our gaps were and what we could do better. But so it was that time frame was 18 months. I would say once we got into it, I had a weekly meeting with staff for about an hour to 2 hours once a week, to literally just kind of sit down and start walking down the standards and building our evidence of compliance, crosswalk, and those types of things. And we probably did that for the better part of 6 months in preparation for our fact visit. So it definitely, as a new program, can be very, very time consuming, and the sooner you start, the sooner you can actually achieve it. I mean, that's the whole thing, is you have to get started, you got to get the ball rolling, and then just kind of dig in from there.
Great answer. Very thorough. And so this kind of goes a little bit off topic, or not, it's on topic, but are physical copies of all version controlled documents necessary? And that's a question that I've had too. Binders and binders of physical hard copies of documents, are they necessary?
From an inspector point of view, I would say no. It's more of how readily are things accessible during the process of the inspection. If you feel that paper's the easiest way to keep things readily accessible, then by all means, paper. The other thing is that the inspection is not focused on reviewing every single controlled document that's in place. The inspection is focused on reviewing the controlled documents that provide evidence of compliance relative to the standards. So some of those standards don't necessarily, for determining compliance, don't necessarily need to be a physical document review. Some of it is procedure, some of it's practice, and at times some of it's anecdotal from interviewing staff and talking with the group that's present during the inspection.
Great. We still have time for questions. So another question is, the virtual facility tour requests list demonstrations of critical processes. Should that also be a part of the video?
I think in as much as you can do that, yes. This is always something with the inspection that is difficult at times, even with the on-site inspections. You have a lot of key people that are associated with the different areas of the transplant program. So sometimes it's difficult to have normal operations going on those dedicated days where these fact inspections are occurring. So sometimes, even with an on-site inspection, there may be processing going on. Other times there's not. It's kind of a coin flip. But certainly, I think from the virtual inspection piece, and especially from an initial accreditation standpoint, I think those videos of mock processes are going to be really instrumental in verifying that you are adhering to all of the relevant standards as you transport, as you process, as you label, and show that product traceability throughout the whole lifespan of that product, from collection all the way through cryopreservation and distribution.
Mm-hmm. Agreed. Another question we have for you: do you and your facility do you perform a mock inspection prior to the scheduled inspection in preparation?
So at our facility, we are going to be going on our 8th round of accreditation. So we don't do that at this point. I think we feel pretty comfortable that. I think the biggest thing for us is when the new standards come out, is to do that gap analysis then, as you're going through the as a kind of continuously accredited program, is when those new standards come out, is to do that gap analysis and do that walk down at that point, just to see what changes potentially need to come into play as far as influencing how your processes and procedures work. So we don't necessarily do a full mock inspection from a reaccreditation standpoint. I would really recommend it from an initial accreditation standpoint. Like I said, in doing apheresis and just getting accredited last February, it was really instrumental for us. We had a few people that were knowledgeable of FACT in key positions around the apheresis unit, but the majority of our staff, one, had never been apheresis nurses, so two, they never had, they didn't even understand what the acronym FACT stood for. So I think it was very instrumental for us to really kind of develop that program-wide knowledge base and familiarity with FACT and why it's so important and what it does for us.
Yeah, thank you. I completely agree. Especially a first, kind of your first accreditation cycle, just so that everybody's on the same page of who FACT is. Yeah. And another question that has come up is how does initial qualification of reagents? How do you do initial qualification of reagents like DMSO? That's it.
So I guess there's a couple of different ways. So in qualifying just the reagent itself, I think obviously the majority of people are not doing secondary testing of batches or of materials upon receipt. The majority of us, especially for just kind of routine BMT processing, are relying on the manufacturer and the quality documents we get from the manufacturer around those materials and reagents. DMSO obviously has a critical role in cryopreservation, so I think in a lot of ways, things like that, you kind of qualify the material in the context of your process validation around cryopreservation. So, so you have a sterile material that meets all of your specifications to process with. So that's kind of your qualification spec, if you will, for that material or reagent, and then you insert it within you use it within the context of the process validation, and to show that it's that the process with these specific reagents work to meet the critical endpoints that you define for validation.
I think the concern from the question was that patient stem cells should not be available for this lot-to-lot qualification. So I think that you've spoken to that. Just one last question, and this is actually coming on behalf of facilities who don't have such a beautiful facility as yours. There's a lot of guidance around space, appropriate space, and appropriate personnel. if you felt like your space or personnel were not adequate, would you volunteer this information to your inspector so that they could potentially bring that up with the fact office so that maybe perhaps they get some buy-in financially from the hospital administration?
So yeah, it's funny that this comes up because um, one of our quality lead over in apheresis sent me a little meme the other day that basically says that nobody invests in quality until until you get cited for something, right? Then all of a sudden, then the money's available to do what you need. Um, so it's just funny that this comes up. Honestly, as an inspector, I have been um, on inspections where people voice concerns about their confines of their processing facility, and it has been brought up. Um, whether that's been the program director or the facility director or staff. Um, I think it does tend to come up, and people do feel that if the fact inspector could just politely cite us for lack of space or inability an inability to properly segregate and manage the space, then maybe we'll get that. Maybe with an official citation, people start paying attention and give us the space that we want and need. I would say that's not necessarily facts role situationally, and that's a difficult premise when somebody approaches you with that, because while you can sympathize potentially with somebody's situation, you really want to look at it objectively and say, do you have are there processes in place and enough space to do the level of work that you're doing? Part of it too is you might be in a small space, but if you're only having one or maybe two products come through that space at any given time, it potentially is very adequate for a low number of products coming through the space. So I think those are it kind of goes deeper. Again, it's about the scope of the program, and understanding the process and the scope and how it relates to the physical properties of the space.
Agreed. Thank you, Charlie, for answering these questions. Brian?
Yes, thank you, Charlie, and thank you, Sarah. A couple of resources for people. Again, if you're interested in the virtual inspection process, there is a video on the featured video section in which the first program that was inspected virtually, which was Baylor, shared their experience of how they prepared for the virtual inspection. And also there's a presentation at 1:30 p.m. Central Time on how to prepare for a FACT virtual inspection. And Suzanne Burnley and Dr. Workington will be present to answer any questions. Last announcement, for those of you that have been on the processing track this morning, you know that we've experienced some technical difficulties. Federico wasn't able to get to the questions that were posed to him during the session. I just want to put everyone's mind at ease that we have recorded those questions and they will be brought up during the panel discussion later this afternoon. So with that, I invite everybody to go back to your schedule and join the next presentation on correcting deficiencies. Thank you.
Thank you.